Welcome to the Medical Fitness Podcast, powered by the Medical Fitness Association and MRF Institute. My name is Thomas Hammett, and I'm the Director of Operations for Pinnacle Lifestyle Medicine. Today's guest is Courtney McCliment, a registered dietitian and certified diabetes educator, and the manager of the Lifestyle Medicine Department at Valley Medical Center in Renton, Washington. In her role, Courtney manages physical and occupational therapists, registered dietitians, a cardiac and pulmonary rehab department, and medical exercise services and staff at a large multidisciplinary site. She is one of the strongest advocates for lifestyle medicine and exercise that I have ever met, and I'm really excited to have her on a recorded line to chat with you all. So thanks so much for joining us today, Courtney.
Thank you so much for having me. I appreciate you being patient with me and being sick last week, so a little bit of a postponing.
Yeah, your voice is back. I went through the same thing as you did. So,
I didn't think your audience wanted to hear me last week.
Yeah, it would have been fun. It would have been a different kind of conversation. Probably too much of me talking, being honest. So, I'm really excited to do this with you, Courtney. We have so many conversations that to me are the kind of thing like this that we don't record. And I think just for the benefit of our listeners, people that wouldn't know how Courtney and I work together, we work on a pretty small leadership team that runs day-to-day operations for this hospital that Courtney specifically runs and manages a big specific site. And because we work so closely together, we get to talk about the minutia, like the day-to-day managing people kind of stuff, but we also get to talk about the big picture and the vision and why we're doing what we're doing. And Courtney truly is one of my favorite people to do that with. And I've wanted to bug you about doing this for a long time. So again, just really glad you're here.
Absolutely. Thanks for having me.
Yeah. Do you mind if we just jump in?
Yeah, go ahead.
Okay.
I'm ready.
So the reason that I wanted to ask Courtney on this show, as you know, her mindset is, I think starts from a nutrition standpoint from education, and she can speak to that a little bit. But I don't know that I've ever met someone who is more of an advocate for exercise as someone who's not actually doing the exercise role. And that just makes her really unique. There are certain people, in the medical setting that are really good advocates for exercise or just for interdisciplinary care. And I think you're one of those people, Courtney, but I'd love it if you could maybe just start with like telling us about your philosophy on exercise and what, what drives you to have that belief in getting your patients to start moving.
Yeah, I maybe just for some background, I've been working in patient care for the majority of 20 years, and early on in my career, it was sort of one-on-one counseling, and I also worked in an acute care hospital facility and saw patients at bedside for nutrition consults. So seeing sort of the disease process on that end of things certainly was I think an important experience for me in building both my knowledge, but also sort of understanding of what chronic disease looks like through the spectrum. I'll tell you in my one-on-one counseling that I over and over early on, I'm in my early 20s. And I have the life experience of someone in their early 20s. I think that my counseling strategies or skills were elementary at that time. I guess I got to a place with my patients where I just felt like they were not successful. For whatever that was. Either they're coming to me for high cholesterol or weight management or diabetes management. And we would get them so far with medication management, and we'd get them pretty good ways with nutrition changes and habits. But I just was running into a brick wall with all of our patients in terms of, getting them to the next step. And that next step was sort of long-term maintenance and management of their condition. I think that came at a time where I myself was also getting more interested in independent exercise of all kinds, both cardiovascular exercise and strength training. And I watched it sort of, I experienced it reform my life in so many ways, from a health standpoint, mental health, all the things. Um, and I realized in my care that that nutrition counseling could only get my patients so far. Nutrition changes were only getting people to a certain point, and without physical movement, they were never going to get to sort of a place where I think that they felt confident and independent in management of their condition. So um, I since then have been building on this philosophy that physical movement cannot just be a hobby. And I think that that's the way that the medical community talks about it so many times, is that it's just nice for the people who want to do it. If you happen to like it, or if it's, something, I don't know, that's the way that it's talked about. It's not given as a prescription the way that it ought to be. Um, it is truly transformative in managing a chronic condition, but also in just maintaining good health and getting us a longer health span. So um, I um I guess maybe I'm not sure if I'm answering your question other than I think exercise is a requirement for all of us, and if we want to enjoy good health through the many years, that it needs to be thought of so.
Yeah, you absolutely answered the question. I appreciate it. And I've found myself over time really frustrated in situations that, and this is more the norm than anything, but where in medicine, medical providers are satisfied with just any more movement than what's happening right now. Like that
Right.
is the status quo. If you leave my office and you do any more than you're doing today, then I'm going to feel like we win this. And it's just such a shotgun strategy that I know we can do better, but there's logistics involved, and I understand the constraints and the barriers for medical providers to recommend exercise. But the beauty of professions like ours, Courtney, for you as someone in nutrition counseling that sits with people, that has some foundational skills around, what we would call motivational interviewing, or just speaking with people in a way that elicits motivation and understanding and learning about themselves. And for me as a physical therapist, we both get to sit with our patients for 45 to 60 minutes on a pretty regular basis. We have the time to have these conversations. So what's our excuse, right? And,
Yeah.
I think the excuse is that it's hard, but I think also some of it is that we're just satisfied with that, just get them moving a little bit more
Yeah.
mindset.
Yeah.
So,
Well, and I think I probably used to be in that camp early on in my early 20s when I was talking to my patients about exercise, is, just let's start moving. And that's great. Exercise prescription needs to be individualized to the person. If you're not doing anything, just getting moving is appropriate. But that isn't going to prevent ongoing insulin resistance. It's not going to prevent, it's not a huge risk reduction for cardiovascular disease, for staving off Alzheimer's and dementia. We have probably more evidence than anywhere else to tell us that exercise uh, done in a specific way, and I don't mean like a specific activity, but intensity and frequency, that sort of thing, it's really powerful in doing all of those things. So you're exactly right. And I think that's where often medical professionals stop is, you know, are you exercising? Yes or no? If not, let's just maybe start walking, which is great if the answer was no to that first question. But having to or helping your patients to continue on that journey is really where we're missing.
yeah. Yeah, and you shared this a little bit already, I think, just talking about your nutrition counseling appointments, but could you help the listener understand if they were in a nutrition appointment with Courtney, what would the conversation around exercise look like in like how you bring it up and what kind of recommendation you might give based on where you're at?
Yeah. Um, I think I think all of us in sort of health education or in the medical community often start with knowledge. But I will say that, in bringing this up with patients, depending on what they're seeking my help for, um, we will eventually be doing some reconciliation of sort of what their initial goals were and where they're at. So although they came to me to talk about food and nutrition, that is the primary thing that we start discussing. But in that I would say final reconciliation of goals, exercise has to come up. And so the conversation is usually, well, I always share, well, or ask rather, what other areas of your sort of lifestyle do you think you could improve? And I would say 8 times out of 10, people will say they will self-identify that it is physical movement, exercise that they're not doing. And then it's just a series of sort of questions, trying to learn a little bit more about their experience. So what have you tried in the past? Tell me about what your biggest barriers are. What kinds of things would you be interested in doing? Is it team sports? Is it, just a gym membership? Is it class fitness, fitness classes, cycling, running, whatever it is. So getting some initial sort of interest in terms of what they are interested in doing. But, and then I think I really always try to tie it back to their goals. So if their goal was, I really want to lose weight, or I really want to maybe take less diabetes medication, is really showing them and discussing the physiological pathways in which exercise will help them do that. And I think it's important to talk about that, not just because, I want to throw knowledge at people, but for so many people, the benefit of exercise is only aesthetic. If I want to look a certain way, then I'm going to exercise. And granted, we all want to, look a certain way. But if that's the only reason people are exercising, it doesn't last very long. It's not a big enough carrot for people to follow. So I need people to understand that there are so many more complex benefits of exercise than just sort of shaping your physical body into a certain way. So I usually talk a little bit specifically to them. How will exercise help me? And so then we have to start talking about what are we willing to do to start, and that as a long conversation, because sometimes that's schedule constraints, sometimes that's just lifestyle in general. Maybe they've never been active, maybe they have, maybe they're intimidated, maybe there's an injury. There's all kinds of things to sort of talk about in terms of first steps and next steps.
Yeah, it's the logistics stuff that, again, like if I was a provider and I had 15 or 20 minutes max to sit down with someone and consult them about their health for the next year, it's my one time in the next year that I get to consult you about your health. I'd have a really hard time sitting down and being the scheduler, the schedule supporter. I mean,
Right.
because it's slow work, and
Right.
it's like you have to watch people bargain with themselves in front of you
Yes.
about what they're willing to do. And if you do it the wrong way by going into logistics before you've got the motivation, right, then you're just kind of planning something with someone that we both kind of know isn't going to happen.
Yep.
Which,
And I've done that.
yeah, that's painful work, huh?
Yes. Yeah.
Yeah.
You hit
So,
on a really great point that, the person you're speaking to has to exert some sort of interest in the topic of exercise, or at least we have to make some effort to understand where they're at with sort of motivation to make a change there. On the polar end of the one side, if they clearly are not interested, then I'm not going to badger people about exercising. There's lots of areas of lifestyle medicine that we can focus on. And if we can find 1 or 2 things that will benefit them, we can sidestep exercise for a minute, but I will keep coming back to it.
yeah, to your point, what I found to be true more and more over time is that when you ask people what step they want to take first, most of the time they don't know.
Mm-hmm.
So it is good to have if I'm the one to make the recommendation, like if I have to be the person to say, this is an additional lifestyle area to look into, it's good to have the answer to that,
Yeah.
And I came into practice assuming that people were going to have this list of things building up in their mind of like, okay, well, if I had time, I'd do this and I'd do this and I'd do this. And I think that is somewhere in people's heads sometimes, but
Mm-hmm.
not always, man.
Yeah.
I've found that that people aren't thinking about exercise or sleep or what they're eating. And maybe they find themselves thinking about one of them and they get to dealing with that, or starting to work on it, I should say. But thinking about areas outside of that, there isn't always an intuitive next step in the mind of the person that you're working with. And that's kind of the journey that you get to help support them on, and opening their mind to it. So
Yeah, yeah. I think there's two things. I often share my own journey around exercise and fitness, and I think it's very humbling, and it also makes me less intimidating, because a lot of the things that I share, or I've been in a similar place. I've been in a place where I haven't been active for 10 years, and I've been in a place where I don't know what strength training means. Like, if you tell me to go do strength training, I have no idea what that means. And for some reason, the public, because of social media and mass marketing, believes that we should all just know this stuff, you know, and most people don't. I would say a lot of women have no idea how to strength train, and like that's not really their fault. That's not their area of expertise, and maybe that's not something that they've been really interested in the past. So um, I just think people have this belief that if they don't know how to exercise, they can find it online. And so one of the most important things that I talk to people about in that initial exercise conversation is, after identifying that they might be interested, I hear a lot of, well, what would you recommend? What would I, what would I start doing in terms of exercise? And I can give some, if we're talking about the person who's not exercising at all, I can give some initial, like, hey, let's get started with doing a couple things this next week. But a point I always make with every patient when I'm talking about exercise is that they need help. They need to engage help, and that it looks like a fitness professional. Um, Even people who have been active in their lives, I think, don't understand the basic principles of safe and effective exercise strategies. Um, so um, there's a lot of very sciencey academic type of theory around exercise that I think exercise professionals can share with the people they're working with. But really, no one is exempt from needing accountability. You know, um, I need it sometimes. There are times in my life where I'm really killing it, and I don't need someone to handhold and to do the cheer, rah rah, and pat me on the back. But sometimes I really need it, and most people can relate to that. When we talk about how many times have you said you're going to do something related to your lifestyle and not done it for one reason or the other, and how helpful would it be to have someone there to say, hey, this is really hard. Um, this is what to expect. You are going to feel like you're dying. It does feel really uncomfortable. To give you a prescription for, what to start out with, reps and just an exercise program in general. So accountability, but also just the exercise science. We can't expect people to know those things. And so I always try to make that point with people, that you're not stupid that you don't know how to exercise. You're not stupid that you tried a lot of times and it didn't work. You just haven't had any help. We talk about this all the time in lifestyle medicine, so I know this won't be new to you, but I would never try to just fix my car based off of YouTube. I I won't even try to do my own taxes. I mean, there's a lot of ways I could self-educate myself to do that by myself, but frankly, I don't want to. And so I don't know what this thing is about people not seeking help for exercise. And that's one of the frustrating things, is that people instead they internalize that, like, I should know how to do this. Um, and frankly, you don't. Even if you knew how to exercise when you're 20, well, now you're 55 and the game has changed a little bit. And so, we need help. So um, I think that's a really important piece that I would recommend, any health professional who's talking about exercise, to relay to their patients.
yeah, I can tell you, as someone with a doctorate in physical therapy and a kinesiology undergrad degree, and who hosts a medical fitness podcast, that I still need accountability support,
Yep.
especially in the phase of life that I'm in right now. I have a 7-month-old and an almost 3-year-old kid at home. And as much as I'd like to say exercise is my number one priority, it's not really close
Yeah.
compared to my kids, my marriage, and other things that I have going on. And I believe in this more than anyone, but
Yep.
that doesn't make it easy. It doesn't make it something that I couldn't benefit from support on.
Mhm.
And your point is so good in that, uh, even if you do know what I know, which, I tell my wife sometimes, she gets frustrated that she doesn't know the exercise stuff that I know, because she was a college athlete, and she generally loves to exercise. She gets frustrated about this stuff. And I have to remind her, like, Katie, I went into pretty significant debt to know what I know. And
Mhm.
it's still hard for me too. So
Yeah.
it's okay,
Yeah.
Um, as you were talking, it reminded me of a shared kind of story that you and I have together. Because I think there's the element of, someone who themselves is seeking the getting started with exercise or getting back into the exercise routine. Um, and then there's the medical providers that make referrals. And what I really appreciated, I think if there was a take home of what you said, or like a 5-word summary, it would be refer to a fitness professional.
Mhm.
Uh, and for all the reasons that you stated. And some of it's that the alternatives just don't meet people where they're at. And we do, especially when you're getting started, need something that's a bit individualized and supportive. Courtney and I worked with we actually were part of starting restarting, I should say, a bariatric surgery program at Valley Medical Center. It was a brief time and for anyone who's not familiar, Courtney probably could do a better job of explaining this than I could, but there's some pretty significant nutrition requirements for getting that surgery. And I will defer to you when I get done with my part of the story, Courtney, on explaining that, because I think it's really interesting. I think people don't know this. Um, but this provider was making really specific recommendations around exercise. And what I would say is I first I appreciate that in preparation for a weight loss surgery, exercise was even on his radar. Thankful to that. But the way he was doing it, I thought was pretty wild. So
Yeah.
maybe, would you mind if I just hand it off to you here, and kind of like, maybe you could share a little bit about what that bariatric nutrition prep process looks like, and
Yeah.
even, what you remember about that situation?
Yeah. Um, uh, the bariatric surgical practice, this was the second effort that Valley had made in its history to have an on-site bariatric surgery and center, and it made sense for them to partner with us, with nutrition professionals, because it's such a crucial part of both preparation and success after surgery. So um, uh, the a lot of the prep work for bariatric surgery is dictated by insurance. So, and I do not disagree with the rationale. Like so many things, there's good intentions, but the structure is set up in a somewhat rigorous and difficult process for people to get through. So they have to be approved for surgery based on a couple of different things. They have to meet a certain weight criteria. Um, they have to be a certain amount overweight. They have to have tried other strategies. Um, uh, they have to be of stable mental health condition. It's not that they couldn't have any mental health history, but it needed to be managed and I would say well managed and under control. So um, those prerequisites, with people, as people got through those, insurance would then say, okay, you've gotten through that sort of first round of qualifications. You now need to lose 10 to 15% of your body weight. You need to visit with a dietitian every 2 weeks for 6 months. And you need to work with a psychologist. So all of those things make a ton of sense, right?
And that's all before surgery.
That's all before surgery. Yeah. So if you can imagine going to a doctor's appointment every 2 weeks, like with everything else going on in people's lives, it's just a difficult process, right? It's difficult to do that. in addition to the things that we're asking them to do. So as a dietitian, ultimately I needed to outline, this is what life is going to look like after you have surgery. So our goal in the 6 months working together is to practice those things. Just by practicing those things, it would produce the weight loss that was required for the weight loss surgery. So the weight loss wasn't really that big of a hurdle to get over, because as people started making these changes, it occurred anyway. But just some of the tenets of bariatric surgery, sort of nutrition, or at least post-surgical nutrition, people really need to be eating small and frequent meals. So 5 to 6 small meals a day. And I don't know, Thomas, is that a eating pattern that you could see being very practical for you?
It drive me nuts. Like I
Yes.
think I could find a way to do it, but it would take a lot of work and it would
Right.
disrupt my life. Like think about going out to eat. Like
Yeah.
if you ever want to share a meal with someone, it's like, hey, can you eat at 10 a.m. so that I can
Yes.
get my third meal in, or
Right.
second meal or whatever?
Yeah.
That sounds crazy.
Yeah. So 5 to 6 meals a day at least. And after 20 years of working with patients and nutrition counseling, I can tell you Americans are generally eating 2 meals a day. They're skipping meals all the time and sort of binging sort of at the end of their day. It's a very typical pattern. And so these patients coming to us for bariatric surgery counseling were no different. There was no structured eating. It was not consistent from day to day. And so that was probably the first most difficult challenge that people had to really start working on from day one, is organizing their day to enable them to eat 5 to 6 meals a day, which was hard. It's just not an easy thing. So I say that as the first requirement or guideline that we gave. But we spent the entire 6 months working on this. It was very difficult. So the other thing is that protein becomes priority number one. So you can imagine not all people like protein, high protein foods. And not only that, but you can't eat large portions at one sitting. So you need protein dense foods. So there was some education around, what foods those were. You had to learn how to count protein. You had to understand how much protein is in this meal I'm eating, and at the end of the day, be able to knowledgeably say, I had this much protein. So they need to eat at least 100 grams of protein a day, and that's at a minimum. Most people needed more than that, closer to 150 grams of protein a day, and the average American is eating under 100. Or I would say for women, for sure. So that was also a very difficult thing to do. Meals needed to be small in size, low in fat. Hydration was another big thing we had to work on throughout the 6 months. They have to take a handful of supplements that cannot all be taken at the same time. So we had to research, what kind of supplements do you want? Do you want them in pill form? Do you want them in liquid form? How are you going to take them? When are you going to take them? Really important for their success. I have seen patients not do the things that we've talked about, including the supplementation, and gotten themselves into a pretty scary place from a nutrition standpoint. So I could go on with more details, but I would say those are, I think I've explained enough sort of about that.
Yeah, it's great. I really appreciate you doing that too. To me, because layered into this, exercise is important. But when you think about everything else that's going on, how overwhelming would it be to also get the recommendation of figure out exercise on your own?
Oh, yeah. Yep. Yep. I didn't
And
even talk about exercise. Yeah.
no, it's okay. It's great. My favorite part of this story, because I was managing the nutrition staff at the time, and there were some feelings amongst the nutrition staff about whether, this was a good practice to support or not. And generally speaking, I think it was well supported.
Mm-hmm.
But I remember getting the list of prerequisites for surgery from the surgeon and his recommendations, and it was a long list. I couldn't believe it. And in coming out of physical therapy to support you all in nutrition counseling, a lot of it was like, I think the saying is like, it was Greek to me. Like I didn't really know what it meant.
Yeah.
But I looked down at the line for exercise, and it was a link to a YouTube channel that had a bunch of high intensity interval training exercises on it. And I couldn't believe that it was like, it was something like do 60 minutes of HIIT exercise a day.
Yep.
And
Yep.
to think about all the other things you just said that need to happen, plus figure this part out, like plus figure this thing out, and don't get hurt and don't get sick, just seemed wild to me.
Yeah. And in reality, Thomas, you know, and I know that patients came in saying, yeah, I'm not going to do that. Like it was pretty clear. You know, they didn't even know what that meant, honestly. So those conversations were very they were widely variable from individual to individual. Some of these patients couldn't really mobilize. They were at a place where their joints and just their weight status were sort of disabling them from any physical movement. So that, I mean, and they got the same recommendation to do HIIT workouts. Um, uh, those conversations were very much the what movement can you do? Let's maybe talk about what's in the realm of possibility here, and then we start doing something from there. A handful of my patients got to a point where they were able to be pretty significantly more active, and at that point, it's time for handoff to help. So I would usually talk to those folks about getting some professional guidance from a fitness professional.
Yeah, that's great. Yeah, I just, again, what I loved about that situation more than anything was that physician, the surgeon that was running the program, really cared about exercise, and I think was trying to do the right thing. And I would hate for this to come off as like, what a crazy recommendation. That's like, I can't believe it. He was trying, and he was doing something and making a specific recommendation that I think probably for him at the time felt like the easy button, or at least a button that he could count on. So just to reinforce the point that you were making about people often need a more personalized, easy button than go watch a YouTube video or get on Instagram and find, a few reels of movements that you like, that look fun. But it's awfully hard.
Well, you make such a good point. You know, that physician, what I loved about him was his passion around exercise and healthy lifestyles. It was just in the way we execute that with our patients, where I think it just it didn't always land for the patient themselves. But there was very good intentions. And truth be told, HIIT exercise is like phenomenal for people if they're able to do it. So I think he knew that, but also maybe just not considering the individual before prescribing that.
It's great. I didn't set out today even thinking that we were going to talk about bariatric surgery, which we don't. There's not currently a program at Valley, but that story to me just sticks out so much in the sense of best intentions, smart person, needed a little bit more from that situation though. So I'd love to pivot a little bit from talking about the bariatric surgery population and talking about type 2 diabetes. And a big part of the role that you play in practice and in supporting the staff in practice for the nutrition and diabetes educators is working with people with type 2 diabetes. And I wonder if you could start by just talking about what exercise in the most ideal sense could look like for people with type 2 diabetes.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. Are you a professional in the medical fitness industry? As a member of the Medical Fitness Association, you'll unlock exclusive networking opportunities with top experts in the field. Access cutting-edge education to stay ahead of industry trends and best practices. Don't miss out on the chance to advance your career. Join the Medical Fitness Association today. Visit medicalfitness.org to become a member. That's medicalfitness.org.
You know, I hate saying this, but that's really complicated, right? Because it really just depends on the individual. I would say that there are some global takeaways, though, however. I really believe, so if we distinguish between type 1 and type 2 diabetes, type 1 being autoimmune facilitated disease, and type 2 diabetes not. For the type 2 population, truly, if we start from nothing, the answer is to get started in whatever way that is safe and doable. The other thing to remember is that I hate to be cliche. It is so true though. The best exercise is the one you are going to do. So we need to identify sort of what kinds of activities this person will realistically do independently. But aside from that, I truly believe that the origin of a lot of type 2 diabetes stems from insulin resistance. And if you follow the breadcrumbs, it is, insulin resistance starting in the muscle. So as we start to store fat in and around our muscle tissue, making us insulin resistant, it has a cascading effect on the rest of our body, and then self-perpetuates from there. So I guess the point I'm trying to make is that we need to sort of get muscle. We need to both increase the amount of muscle we have and increase the quality of muscle we have. And so I'm a big proponent of strength training. That's all. Saying all of that though is if the person can only get started doing walking, then that is a great way to start. So I know I keep coming back to it, but I just want to be clear that I'm not telling people to jump into strength training if they have never done it and haven't had any experience with it. So I feel very strongly that we need to be protecting our skeletal muscle. So that means we need to use it. And so strength training is something that I think is really important. Maybe it's not the first thing that we come to when we start exercise, but it has to be part of the picture eventually. Just doing our steady state cardio, whether that's running, walking, all those things, does not build the kind of muscle that we need to improve insulin resistance, but also manage type 2 diabetes. So in reality, we need both. We need both cardiovascular exercise and strength and resistance training. So they both have benefits specific to type 2 diabetes. But I guess I focus on strength is because I think even more so than just exercise as a global topic, strength is looked at as a nice to do kind of thing. And I want people to really identify strength training and resistance training as really a crucial part of physical movement.
That's great. I really appreciate that. We're as a podcast, we're kind of starting to pivot the way that we do these interviews, probably starting in the new year. Hopefully it's okay that I announce that. I guess I'm announcing it right now. But one of the conversations that I hope that we have early on is really around the thing that you said that I think was so good and true, and it reinforces. There's 5 other people that have said this that we've recorded saying the same thing, which is the best exercise that you can do is the one that you're going to do. And I believe that to be true. I also believe that that's step 1 for a lot of people. Like right. It is that, but if you're going to start moving your body, I mean, let's say that it's sport of some kind. Mm-hmm. And you want to have some kind of longevity in that sport, it probably means you're going to have to start preparing to do that sport, which may mean stretching. It certainly means, practicing the movement outside of performance. And this is just an example, but some kind of resistance training is important to have strong muscles and bones to do the sport. Mm-hmm. And I really appreciate that you went beyond that, because I think when we think about best for anyone who's not doing it versus ideal anyways, which, isn't the world we live in, but I like for people to know what that ideal is so that when possible, we shoot for it. That building skeletal muscle and doing resistance training is really important.
Yeah. I came to this information late. I mean, I knew that skeletal muscle utilizes glucose. I knew that, but I thought of it mostly in the context of substrate utilization, like people using glucose while they're moving. And I think I forgot about the role of skeletal muscle in metabolism in general. So as we consume carbohydrate, about 75 to 80% of that carbohydrate goes straight to muscle. So if we are under muscled or poorly muscled, that initial side of metabolism is dysfunctional. And so it is for so many reasons, such an important facet of exercise to focus on.
Yeah, I think particularly in the world that I live in, skeletal muscle gets recognized for its functional role in how we move. And what you're talking about is really that there's a metabolic benefit to having skeletal muscle, which I think people just don't
No.
recognize. They don't think about when thinking
Yes.
about why they exercise.
Mhm.
I think you just explained that really well.
Yeah, yeah. I always describe it to my patients that it is kind of like, you know, have you ever heard that acronym FIFO, first in, first out? It's like it has to do with like warehouse storage strategies and theory. Like, but both the fat and the glucose that we store in skeletal muscle needs to be moving in and out. It shouldn't be just staying in there. And we don't have an infinite capacity for glucose or fat in our muscle. We have an infinite capacity to store fat, other places in our body, but not in the muscle. And so as we start to fill up that compartment of storage, your body doesn't have anywhere to put it, so it just turns it away. And then it says, well, I'll go try the liver. If it can't fit into the muscle, I'll go try the liver. And then when we fill up the liver's capacity, which we have a finite capacity there as well, now if all the storage is full, we have nowhere to put that glucose. And what happens to that glucose? Then it creates a bunch of problems. And this is really the root of all the diabetes complications, is that it's incredibly inflammatory to have higher than normal levels of glucose floating around in our bloodstream. So it's very inflammatory on that side. And I'm losing my train of thought, but I think what you just said, that people don't know that it is that the muscle has such a huge role in metabolism, is true.
Yeah, that's cool.
Yeah.
I appreciate you going into the deep end a little bit there on
Yeah.
the details, because despite how many times you and I have talked about this stuff, I always feel like I pick something new up from you each time we chat about it, and I thought that was great. So
Yeah.
one of the tools being used to help support people with diabetes is kind of this new technology called continuous glucose monitoring, is abbreviated as CGM. So if you hear Courtney say CGM, because I think it's part of, we just abbreviate everything in medicine because we're the worst.
Yeah.
But CGM is a big new strategy. And I wonder if you could tell us a bit about CGM. I know it's something that you're working on in, at Valley with the registered dietitian and exercise staff. And even if, maybe let's start there. Tell us a little bit about CGM. I think it'll later tie into exercise, but let's just start kind of with the basics of what it is.
Oh, I think just to keep it simple, continuous glucose monitoring is obviously a way for us to know how much glucose or sugar is floating around in your bloodstream at any given time. 20 years ago, we did not really have this technology, or that it wasn't really widespread. And we had to, the only method we had was to poke our finger and put it on a strip, put it into a machine, and that would tell us our blood sugar at that time. And even longer before that, before we had those strategies, we just had to pee on a stick and we weren't necessarily looking for glucose always. Well, we were, but that's a very rudimentary, crude way of looking at blood sugar. So, and indirect. So fast forward to now, we have this super cool technology, continuous glucose monitoring, and instead of having to poke your finger, it's a sensor that that sits somewhere on subcutaneous fat, somewhere on your body. Sometimes it's the back of your arm, sometimes it's your belly. That will tell you what your blood sugar is every 5 minutes. So you can imagine that if you wanted to know your blood sugar, Thomas, right now, and you only had the conventional glucometer, which is the machine we used to use to poke fingers and check blood sugar, to do that every 5 minutes is unrealistic. Nobody would do that. And so as a diabetes educator, it was very frustrating that, my patients would come in and they have checked their blood sugar 2 times in the last week. And what that tells me is what their blood sugar was whenever they checked their blood sugar. It doesn't tell me about the rest of the 23 hours plus about their day. So it was very limited, didn't really tell us very much. And so CGM has the power to tell us blood sugar over the course of a 24-hour period. And so most of these sensors last for about 10 to 14 days. And so we get to see blood sugar patterns over up to 2 weeks, which is really valuable. So as you can imagine, it's so much more helpful to see that information related. Like if I'm the person wearing a CGM and I eat Panda Express, I can see what my blood sugar does in the immediate time following eating, the Panda Express. Whereas if I was just checking blood sugar with a finger stick, I would have to be strategic in timing. First of all, I would have to remember when I ate the Panda Express and then check it after by an hour or 2 hours. So it gives people really great immediate feedback about their lifestyle behaviors. So how did that meal affect my blood sugar? How did my crappy night of sleep affect my blood sugar? How did this stress that I'm undergoing right now affect my blood sugar? What about when I exercise? What happens when I exercise and what happens to my blood sugar? And that's what I'm trying to work on currently. So many times we tell patients, oh, exercise is really good for you. It's doing all of these things for you. It's lowering your blood pressure. It can lower your blood sugar. It heightens your mood. It has all these benefits to your blood vessels in general, reduces risk for all kinds of things. But these are all things that are not tangible. People they're not conscious of their blood pressure being improved in an exercise session. They're not conscious of, all those other benefits I just rattled off. So being able to see that, oh my gosh, my exercise session, the 30 minutes of jogging that I just did lowered my blood sugar for like 48 hours. It was lower because I did one single bout of exercise is such a powerful feedback, piece of feedback for people. And there's nothing more, important than really trying to get people organically engaged in exercise, and independent at understanding how good that exercise was for their body. So CGM is a relatively, in the world of medicine, a relatively new tool that we're using. Primarily, I think initially was helping us a lot with medication management. So is the medication you're taking actually doing what we want it to do? And if not, how can we problem solve? But then as we expand, it has so many implications in terms of people's food behavior and physical activity and exercise. So I think there's a really, we're headed into a really exciting time. Now, just because we know better doesn't mean we do better. Right. But at least people have this information and it's more immediate than my lab work done every 6 months type of thing. I can make real-time changes based on the data that I'm receiving. So it's a little bit about CGM. Have I answered your question?
Yeah, it's great. I've been surprised how many exercise skeptics there are. Like the number of people as a physical therapist that I met that were like, exercise just doesn't work for me. And that what you're just saying about the immediate feedback of you exercised and then there was a result and you can see it. Like it's something that as a PT, it's like, okay, check this out. I'm going to measure your range of motion of your knee when we start the session. We're going to do some manual therapy and some movement, and then we're going to measure it at the end. And we're going to see if it gets better. And it always does, by the way. Not just because I'm fibbing the numbers, but because in reality, when people move, some pretty miraculous things happen to our joint mobility and our pain response. And that immediate feedback is really powerful to people who are skeptical and who may or may not want to believe in the reality that movement can be a powerful medicine. And we need teaching tools like that. Like we need immediate feedback. to help people understand the value of things that, to your point, they wouldn't otherwise be able to necessarily experience or see. So this CGM seems really powerful.
Yeah, yeah. And you think about some of the biggest reasons why people are not successful with sort of independent exercise over the long term. They're fixated on things like body weight, right? So like I do my exercise session and did my weight change? No. So and maybe if I did that exercise session for 2 weeks, did my weight change? Maybe not. You know, and so if we are only measuring things like body weight, that I can understand why that would be discouraging to people. So CGM offers a new sort of new data for people to wrestle with.
Yeah. Yeah. This may be an impossible question to answer because I recognize that individual responses, if you say individual responses, I will understand to answer the question that I have. But I'm curious, just in your experience of working with people who are using CGM and exercise, people with type 2 diabetes or maybe with prediabetes, if you've seen that, what is the typical response to exercise with glucose? Is it kind of what you were citing before of it's typical to see blood sugar drop? Is it we actually see blood sugar go up? I'm making this stuff up because I don't really know.
Yeah.
Again, is it possible to make generalizations like that? Do we see what typically happens or?
Yeah, there is a typical there's a lot of variance like you mentioned. It kind of depends on what the person's baseline activity is already. So for me or for you, people who are active, if we got on a treadmill and started, running, that's not a foreign activity to us, right? That movement is not foreign. So we would have probably not a lot of huge excursion in blood sugar immediately, but when people start exercise, they can expect to see, and let's say they're using CGM, they would likely see kind of an increase in their blood sugar immediately, because there's a pretty significant stress response that happens to exercise for all of us, but definitely for someone who is new to exercise or new to that movement. So it's pretty typical to see an increase in blood sugar while the person is moving. So I always counsel my patients that this is probably going to happen. Don't panic. It doesn't mean exercise is bad for you. It means that your body's doing what it should do, and it's a stress response to the exercise. But in the hours following the exercise after you've stopped, we should see a improved insulin resistance, therefore improved blood sugar levels for up to 72 hours post-exercise. Now, it depends on the intensity of the exercise and the duration of the exercise of how long that will last. 72 hours is kind of a long time, honestly. It would have to be kind of a pretty intense and good duration bout of exercise. But for most people, they can expect an improvement in their blood sugar over the next 12 to 24 hours at least. So that's pretty common and typical.
Yeah, that's cool. I really appreciate you sharing that. For the listener who wouldn't know what's going on in Courtney and I's lives, Courtney about 4 months ago or so was really passionate about starting a pilot project of integrating CGM, continuous glucose monitoring, into the exercise program that we run, the medical exercise program that we run at her site. And we started to do some research. I just wanted to know kind of like what protocols were being used, if any, in other places, what the research said about CGM. And one of the things that I thought was so interesting is I was expecting to see exercise improves glucose levels. Like that's kind of what I was expecting the conclusion to be. And what I found in looking through research articles was this dual effect of, yes, that's true, but also people who use CGM when they're starting to exercise tend to exercise more. And I thought that was such a fun conclusion that CGM as a learning tool is, kind of the way that they're proposing this to be is if you use CGM, you're getting insights that you wouldn't otherwise get, and that's part of the hook for exercise.
Mm-hmm.
So I thought that was really fun to learn, for anyone out there that has the ability to start thinking about, what kind of add-ons can I do in my exercise program, or, who should I link up with to get more more engagement with the population of people that have type 2 diabetes, this is a really cool tool that if you can work with someone who has enough nutrition know-how to guide people through what they're seeing on the CGM, you could do something really, really great that moves the needle on people getting engaged in exercise.
Yeah, I'm really glad you brought that up. That is probably, I don't know, it might be number 2 in terms of the primary outcome of our pilot, is sort of increased engagement in our exercise program. So yeah, great point that you brought up.
Yeah. I think probably, Courtney, do you want to get into motivational interviewing? I think I probably have time for one more question. And we talked about before this call, and just for the listeners' context, Courtney, obviously, I've shared her background. She manages a pretty big multidisciplinary staff. One of the things she does for all of these people is provide a motivational interviewing, onboarding. And I think it's something that she, just at a baseline level, is very knowledgeable. And not to say baseline level, you've done a lot of work to get there, but very knowledgeable and skilled in your practice in utilizing the skills. But it's a big subject. So how do we talk about something meaningful in a short period of time? I don't know. I'm curious if there's anything you'd want to share with people about that.
Yeah, there's a lot. I don't really consider myself an expert in motivational interviewing. I just really believe in it. And it is through that I've really wanted to share it with our staff and with my peers. And so I can tell you as a dietitian and diabetes educator for a lot of years now that just knowing things and being really smart and really wanting your patients to do the thing that you're recommending and just telling them to do it, it just doesn't work. And that is the skinny of it. It just doesn't work. It just telling people that they should do something that's healthy alone does not work. So I mentioned my earlier days and being kind of a naive counselor at that point. I've tried all the dirty ways that we do in healthcare. I've tried to intimidate people, to threaten people, and not in an overt way, but kind of like in an underlying sort of between the lines way. And I've tried to just over-educate people to death. If only they knew, all the reasons why, maybe they would do it, So it was upon realizing that that wasn't working for me to sort of try something different, a different approach. And that is what motivational interviewing is. It is a counseling style designed to help elicit motivation that already exists in the individuals that you're working with. It isn't me making a motivational speech to try to sort of pull them along to make them do the things that I think that they should do. It is trying to help them dig up their own motivation because it is there. It's just buried. And there's a lot of conflicting things getting in the way. But it's their counseling strategies to help others sort of come up with their own reasons why they want to make change in their life. I've used this a tremendous amount in my professional career. I've used it with patients, obviously, but I've used it a lot with my peers. You mentioned that I manage staff. I use it all the time in conversations with staff. And I use it tremendously with my 2 teenage daughters. So if anyone wants to know if this actually works, it works. If there's a more difficult population than 2 teenage girls, then you can challenge me, but it's been tough. So motivational interviewing was really first developed, I believe, to as the counseling strategy to address substance abuse and addiction. And from there, it really just expanded really to all other industries. So in healthcare, it has so many valuable places, but it includes some tools and strategies, conversational tools to sort of help your patients that you're working with or individuals to, like I said, self-identify reasons why they want to change. So I would encourage anybody who is working in healthcare, but really anybody, any human being, if they care about the people they're working with, whether that be patients, their coworkers, or their family and friends, to consider looking into motivational interviewing. Uh, yeah, I think it is one of the most important things we can do in helping people, and that's our mission in healthcare, is to help people. So if we can be really smart, but if we can't help our patients engage with that information and apply it themselves, then it's generally useless.
Yeah. I have two follow-up questions for you that should be pretty brief, I think. The first at the beginning, when you were talking about the strategies that you had tried before going down this road, you were talking about threats. And I'm assuming that you're not the head of some dietitian mafia and that these aren't scary threats, but I'm curious what that looks like to like from, because I think it happens all the time. But like, what do you reflect on that having looked like for you?
Oh gosh, I know. And I wouldn't be able to say this had I not done it. But I can say I have said things to patients like, um, I'm really concerned about you. Like, so it starts with that. And I'm really concerned because, you know, I don't know all the examples, but like I'll cite something in their medical history, and, you know, I'm really concerned that this is going to eventually result in a cardiovascular event like a stroke or a heart attack. And while that's educational, that was kind of like an underhanded threat. Like, if you don't do something about this right now, you are going to have a stroke or a heart attack. Which that could be true. But I would ask anyone doing that, there's no utility in doing that, because all it does is strike fear in the person you're talking to, resentment, and definitely they're going to arm up and be super defensive. So it doesn't get anywhere. It doesn't get us anywhere in the relationship with the patient and in their willingness to sort of engage with the information you're giving them. So when you sprinkle any situation with fear, resentment, and anger, there's going to be no positive forward progress in that. So that was one example. You know, patients describing symptoms that they were having. Maybe it was they're peeing a lot, or maybe they're really itchy, or they're having a lot of pain, or their neuropathy is getting, really painful, and saying things like, well, it's probably just going to continue to get worse if you don't do, if we don't improve your blood sugars. And I can tell you 99.9% of the time that I have said that, that's an information people didn't know. I didn't need to say that to somebody. Like, they were already aware that, like, they were in a scary place, and I didn't need to sit in front of them and sort of scare them more. Now, I'll tell you, as a young dietitian, I had good intentions. Like, I really did, I really did care about the people that I was working with. And I thought that would be, through education and sort of scaring them would sort of jar them awake and make them change behavior, but it never worked for me.
Yeah. I reflect on like my childhood, gosh, I wish I could remember a good example right now, but if you keep doing that, if you eat a watermelon seed, you're going to grow a watermelon in your stomach, kind of thing, even like little things like that. They may be like a gentle threat in the way that you're saying it, because you're not literally the one threatening them, but it's if you do not do X, Y might happen, and that's scary, isn't it? Can we all agree that that's scary?
Yes.
And to your point, it doesn't seem to work. So if you, and this is kind of the second question I wanted to ask you, I have found that sometimes when teaching like the X's and O's, the what motivational interviewing is, that I get resistance from providers who are afraid that some of what we would call the skill of motivational interviewing, like what you do, is awkward or unnatural. To ask open-ended questions, to use reflective or summarizing statements, can feel initially a bit robotic. And I'm curious if you have any thoughts about that, just from your experience in teaching this, or yeah.
Yeah. I think there are pieces in teaching this so many times to peers. I've recognized that there are parts of motivational interviewing that are naturally intuitive to people, and there are parts that are not. They're definitely not intuitive, meaning that it feels unnatural. That's where people start feeling really robotic. Um, Part of what is scary about motivational interviewing is that it is really they're leading the conversation, the person you're speaking with. And so I think letting a patient control a conversation sometimes can feel a little scary because you don't know where they're going to take it.
Mm-hmm.
And also it involves some amount of sweaty silence. I call it sweaty silence because you have to ask a question, and then if they don't respond, we need to just give them the space to actually respond and not talk through it. So it does. I want to recognize that motivational interviewing does feel uncomfortable for some people. I think the strategies that I've used, and I hate to say this because it's not very, I don't know, inviting or practical, but is really just learning the skills and trying them out. So I always encourage the people I'm teaching these skills to try them with the people that they care about in their personal life. So maybe with coworkers, but with their friends and family, where it feels maybe a little safer to do that. And I think with practice, people can sort of get themselves to a more comfortable place with some of these skills. But oftentimes, the people, I always ask the question when I'm teaching motivational interviewing, have you ever talked to somebody who does a nice job of reflecting what you just said back to you? Or have you ever talked to someone who, upon you sharing something painful, all they do is dispense advice? And all the hands go up, right? Everyone's had that scenario where they're, talking to someone and they didn't want advice, but they just got a whole truckload based off of what they just said. And that usually helps sway people in terms of, oh, I can see why this is helpful. That's another scenario where people have the best intentions. The person you're speaking to who just gave all the advice have the best intentions for you. They're trying to help, but that's not always what we need. And so I think, anyway, I don't know that I answered your question other than I think people just need to learn about it and start trying it, to sort of see the value and how beneficial it can be in building relationship.
Yeah, I agree. And I really appreciate you saying that. My experience, even in trying to utilize some of the skills that I wasn't very good at first myself, I, started practicing on my wife naturally, the person that I talk to more than anyone else in the world. And there were things that she seemed to receive completely naturally, like didn't know that I was fumbling through trying to learn something new. And there were things where I could see her look at me like, are you trying to trick me into saying something? Like
Yes.
she was like a skeptic a little bit in the way that I was asking her questions, maybe. And you know what I remember feeling like I needed to reinforce is like, I'm not doing this because I want to trick you. I'm doing this because I'm trying to be a better listener. And some of these skills just aren't natural to me.
Yeah.
And I know that it's awkward and I appreciate your feedback, but I'm really trying for
Yeah.
the purpose of, of us, right?
Yeah.
And again, I think anyone who's trying this stuff, that particularly in medicine where our patients expect us to be the source of authority and knowledge, that sometimes we're going to ask them open-ended questions where it feels like, we're asking them to put skin in the game. We're asking them to use their expertise as themselves, and they don't like it. They just want to be told what to do. So you're going to get pushback because people do want to just get the answer sometimes. And some of this is believing in doing the thing enough to go through the awkward stage, to put that other person across from you in charge of the conversation as much as you are.
Yeah.
It can be awkward at first and it can be hard.
Yeah, that example I gave you about threatening someone with, a heart attack or stroke. I guess a practical example of motivational interviewing in that particular scenario, so many times I have said to patients, tell me what your goals are. What are your goals? You came here to talk about your diabetes management. Tell me a little bit more about what that means for you. And they will say, I want to avoid a stroke or heart attack. Like, it's so much more powerful for them to say it themselves than for me to threaten it. It's true both ways, but you will gain so much more engagement from them recognizing that themselves. And motivational interviewing does such a nice job of getting people to talk things out that maybe they've never said out loud before. So it brings them a sense of clarity in terms of their goals and motivation and thought processes that really help sort of build the path to change. So anyway.
That's great. I appreciate it, Courtney. For anyone wanting to learn about motivational interviewing, there's a lot of good free knowledge out there about motivational interviewing, some good articles, some good YouTube videos. Brene Brown obviously is fantastic if you want to learn about this stuff. Courtney's good at teaching it, but I'm not going to give her knowledge away for free. So beyond this, at least. So I really appreciate you sharing your knowledge there, Courtney. As we wrap up today, the last thing that I ask, if our listeners wanted to learn more about you, is there anywhere that they could go to see what you're doing?
Yeah, I'm not really a public in the sort of public atmosphere. So I guess contacting me through email if there's questions would be fine.
That's great. Okay. Well, we'll put your email address in somewhere accessible for the listeners. But
yeah, this is the most famous I'll ever be on your podcast. So
we'll see. We'll see about that. Well, I really appreciate your time today, Courtney. Thanks so much for obviously all the work that you do in supporting us. But also just for the great conversation today. I think there's a lot to learn. We could have talked probably the entire time about motivational interviewing if we really wanted to, amongst other things. So it was really fun chatting with you. And thanks again. Yeah.
Absolutely. Thanks so much for having me. This is really great.
Yeah. This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.